Hello beautiful people, it's a sunny Thursday afternoon and as usual, I'm excited to come your way once again. I find myself at the premises of Sterida Pharmaceuticals Limited to meet a wonderful lady, Miss Eunice Nanaya Boatma Buedu, who is an MCA, to take us through an educative session. Let's get right in and meet her. See ya! Hello.
Hi, baby girl. Oh, baby.
How are you doing?
I'm doing good, and you?
And how is work?
Not bad, we are cool.
Anyways, I'm also fine. And so viewers, we finally met her. Let's settle in and see what she has for us. And so this afternoon, we decided to take a shift from the normal interviews and branch into the medical field. Miss Buedu will be helping us on how to organize first aid kits for our homes. And before we start with that, I'd like to find out from her, Miss Buedu, please, what exactly do you do?
Okay, thank you for the opportunity. I'm Eunice Nanaya Boatma Buedu, and I'm an MCA, Medicine Counselor Assistant. Yeah.
Okay, so as I said earlier, you are going to help us with how to organize first aid for our homes. So what exactly do we need? And I can see so many things here. So can you please take us through?
Okay, first of all, I would like to tell us what first aid is. First aid is the emergency or immediate treatment given to a person who is injured or ill until proper or further medical attention is given. So first of all, with minor illness, first aid should be okay. With major injuries or severe injuries, you can continue with the first aid until proper medical attention is given. So first of all, this is our first aid kit. Ideally, you should have a bowl. It can be a bowl with a cover bigger than everything can contain, or maybe a bag with a zip that you can close. You can keep a first aid in your homes, your cars, your offices, etc. So now we have our bandages, our ointments, our plasters, our analgesics, which is to reduce pain, our antiemetics in case somebody is vomiting, our antihistamines in case someone is having itchy. We have anti-diarrhea, we have vitamins also in our first aid box.
Okay. So I'm here wondering, if you are going to organize a first aid kit, do we need all these? Isn't it too much for a first aid kit?
Okay, some are very necessary and some are optional.
Okay. Okay. So can you take us through one after the other so that our viewers will know exactly what we are talking about?
Okay, so now I'll start from, we have our thermometer. And this can be optional. Sometimes it's also necessary because at night a child might be running temperature. You wouldn't know exactly what is wrong with the child, so you need to test for the temperature of the child. And you also have to have a little knowledge about what your first aid contains. Okay, so this is our thermometer, and then we have our BP monitor. It's also optional. Okay, and then we have our glucometer, which is used in checking our sugar level, which is also optional.
Can you open so we have a look at it?
So it contains this. It's optional. Yes, and then we have our anti-diarrhea. We have our Imodium or collodium.
Okay.
And then we have our ORS and then our zinc tablets.
That one too, what does it do?
Yeah, so that's one in case a child or adult is having diarrhea and then you can't take the child to the hospital immediately. You can just add this to 500 ml of water and then you add the zinc tablets just to stop the diarrhea and then gain back the fluid that the child or the adult is losing.
Okay. What's next?
And then we have our antacid. So this is the suspension adult can take, child can take. This is the tablet, chewable. And then this one too is taken when maybe you have excess gas or you have indigestion, and then you can't go to the hospital immediately. So this is very necessary to keep in your first aid box. The same as the anti-diarrhea is also very necessary to keep in your first aid box.
Okay. So this one, so a child can take?
This one, a child from 8 years.
Okay.
Yeah, and above.
Sure. Well, next?
Yes, and then we have our vitamins. Normally, it's not advisable to keep a lot of vitamins in the first aid box. The most important thing is the vitamin C. This is the soluble, you put in water, you take. Maybe you have cold, or maybe you have a
Sore
pain
throat.
in the throat, yes, sore throat. So you can take this to reduce it, the cold, and then the pain as well, until proper medical attention is given.
Okay. So this together with this?
No, this one is for the adults.
Okay, and
Yes,
this is
this one
the
is for the
child.
adult one, and then this one is for the child.
Okay.
Thank you.
And then?
And then we have our analgesics or antipyretics, which reduces temperature. This is our paracetamol for the children. This is normally, most of the time, when you give the syrup, they don't respond quickly. So we have the suppository as well. This is for the kid. This is for also 8 years and above. And then we have the 100 for the adult. This is diclofenac. This is paracetamol. What this does is it reduces the temperature. And then this one is for pain, maybe back pain or joint pain, and then you are not able to swallow the tablet. You can use the diclofenac to reduce that pain.
Okay.
Yeah. And then we have our antihistamines. Yes, so this is our
Anti what?
Antihistamines.
Okay.
Yes.
Antihistamines.
This is where somebody have allergies or itching, which you don't really know the cause. So immediately you can't take the person to the hospital. So this is the first aid. This is the syrup. This is the tablet for adults, syrup for kids. So you give this to stop the itching. If you give this for the first aid and then the itching stops, fine. But then if still it continues, then proper medical attention should be given.
Okay. What next?
And then we have our bandages, we have our ointments. In the first aid box, you have to have an ointment which is suitable for boils, for cuts, for bed sores, for cracked lips, for piles. So this ointment it's for all areas, for cracked lips, for burns, for cuts, for piles, for boils, anything. So you need this. And then we have another ointment for pain. In case maybe you have body pain, back pain, and then you are not so comfortable with swallowing tablets, you can just use this to rub the affected part, and then it can relieve you.
Before you go to the hospital?
Yes, before you go to the hospital. And then we have another ointment. This ointment is an antibiotics. This is also another antibiotics ointment. This is also another antibiotics powder. For instance, if maybe you have a cut or you have burns, so you can apply this one on it to avoid any infections. Yes, so first of all, you will clean it with the methylated spirits, and then we have our dress solution, which is also an antibiotics, and then you also clean with it before you can apply your
And what do you use to
antibiotics.
clean
And
it with?
we have cotton balls.
Yeah, hold it.
Yeah, so we have cotton balls. That is what you use. First of all, you have to have your gloves. So you have to put on your gloves. So the gloves too is very necessary in your first aid kit.
Okay.
And then we have plasters. Maybe it will need a plaster or a bandage. We have bandage. We have the plaster strips. We have the plaster roll. We have the gauze bandage. And then we have the Vaseline gauze. This gauze is medicated or sterilized. Okay, so there is no need to add ointment when you are applying it on your sore. You just put on it, and then you just wrap it with the gauze bandage or the crepe bandage. And then the scissors too is very necessary in our first aid kit. So this is GV paint, normally known as gentian violet. Also for maybe lip sore, and then maybe some cuts or wounds on the body. And then we have our Vaseline, especially for maybe you are in the kitchen and then maybe hot oil pours on your skin. Immediately you can apply the Vaseline to avoid blisters.
Okay.
Yes. And then we have our diachilates, also for stomach disorders, discomfort in the stomach. Yes. So I think basically I am done with whatever we have in our first aid box. This is also vitamin C, but chewables. And then we have another one called promethazine. This one is when the child is vomiting continuous, especially at night. The child is not running temperature, nothing is wrong with the child or even the adult, but then the child keeps vomiting, cannot sleep. So you give the promethazine to stop the vomiting. Then the next morning you can take the child to the hospital.
Okay.
So basically that is it. And then we have our lozenges also for the pain in the throat.
Okay. So who should administer the first aid? Can anybody administer first aid?
As I said before, anybody can administer the first aid, but then you have to have a knowledge about it. Yes, you have to have a knowledge about it. And one thing that we advise is you have to label your medications.
Okay.
Any medicine you have in your first aid kit, you have to label it. If you can't label it, when you go to the pharmacy for them, you can tell them to label them for you age by age. So it's there bold. So even if you are not around and then you want somebody to help you in the home, you just call the person, take this medicine, this is the name, the dosage is on it. My child is 3 years old. So you see the age there, then you can administer. And then you should also let them label it in such that if somebody takes this, the person will know that it's lozenges for the sore throat. If somebody takes this, the person will know that it's paracetamol to reduce temperature. We don't want a situation whereby the person is running temperature, but then you'll be giving diclofenac. Even though diclofenac is a painkiller, but then it's not to reduce temperature. Okay, so you have to label it. Maybe this is painkiller for reducing temperature or something. Headaches, toothache, etc.
Okay. So at what point do you go to the hospital after administering first aid?
When you realize the first aid is not working, like for instance, in the morning, the child was running temperature or the adult was running temperature. Now it's past like 6 hours, 8 hours, the temperature is still there, so you have to take the person to the hospital immediately.
Okay. Ms. Boedu, you mentioned that the glucometer and BP monitor is optional. So I want to find out, what about the hypertensive patients?
For that, it's very important if you have an hypertensive patient in your home or a diabetic patient in your home, it's very advisable to keep them, or even yourself, the mother or the father. If you are none of these, it's very advisable to keep them in your homes, to be checking regular, because of late BP and diabetes are very common in our society. So it's very advisable yourself, be the parent, you keep it and then you be checking, even if you don't have these people in your homes.
Okay. I also like to know, I can't see any anti-malaria, antibiotics, pregnancy test kits, emergency contraceptive pills, aphrodisiac. I can't see all of that in here.
And condoms.
And condoms, yeah.
Okay, so first of all, I'll start with the emergency contraceptive, the condoms, and then the aphrodisiacs. Let's keep in mind that we have kits at home. And with the condoms, it is boldly written on it, condoms. With the aphrodisiacs also, it is boldly written on it for sexual weakness. And then with the emergency contraceptives to the same thing. The kids nowadays know how to read. Even if they are 3 years, 4 years, they know how to read. And then we don't want them to know that all these things are in the system. Maybe when they grow up and they know, fine. So it's not advisable to keep them in the first aid kit. You can keep them in your wardrobes or your handbags, okay, if you think it's an emergency something for you. But then with the anti-malaria too, we are not advising that we should do self-medication, because if we have the anti-malarias in our first aid kits, the moment somebody is feeling headache continuous for like 2 days, feverishness continuous for like 2 days, the person will assume that it is malaria and a fever. It's me or malaria draw my first aid kit, so let me just take it. That is self-medication. Maybe it could be something more than what you are thinking. So we don't advise we keep anti-malarials in our first aid kit. And also you made mention of antibiotics.
The oral.
The oral one. Okay, so with the antibiotics, we are trying to advise people from the continually abusing of antibiotics. Because of late, people treat diarrhea with antibiotics, even though in some points antibiotics are needed in the treatment of diarrhea. But what kind of antibiotics? So we don't advise keeping antibiotics in our homes.
Okay, so at what point do you cross the line between self-medication and then administering first aid?
Okay, that is where you have taken the first aid for more than 24 hours. If for more than 24 hours your condition still persists, then I advise you go to the hospital. You shouldn't be doing first aid for more than 48 hours. It's not advisable, because maybe what you'll be experiencing will be more than the headache or the cold or the diarrhea you think you are feeling. It's maybe something huge or something different from what you think. So we advise within 24 hours and you think the first aid is not helping, then immediately you seek a doctor's attention.
Okay, and why is there no blood tonic in here?
Yes, there is no blood tonic because you cannot tell yourself that I am feeling this way, so I need a blood tonic. What kind of blood tonic? Is it a blood tonic that contains both iron, zinc, etc., or only iron? Here, you can't tell what kind of blood tonic you need. And what will happen before you think you will need a blood tonic? You don't know. So we also don't advise that you keep a blood tonic, but then you can keep vitamins like vitamin C. After vitamin C, we all know it boosts the immune system in case you are having cold. Okay, so you can keep the vitamin C. That one is advisable, but then with the blood tonics, it's not so advisable. You only take it when it's necessary and then based on doctor's prescription.
Okay. Ms. Bodu, do you have any organized first aid in your pharmacy, and what are the price ranges?
Yes, I do. The price is between 50 cedis and then 300 cedis. That depends on what you need in your first aid. If you need only cottons, bandages, plasters, ointments, methylated spirit, then I think 50 cedi will do, or even less than 50 cedi. But then if you want to keep the anti-diarrhea, the vitamin C, and the anti-emetics and antihistamines, I think you should budget for something that
can take care of all that.
Yeah.
Okay, sure. Ms. Bodu, your final advice to our viewers.
Okay, so my advice to everybody is, first of all, you have to keep all these medications out of reach of children. Secondly, you have to make sure you label your medications, the doses and the dosages, and then according to ages. Thirdly, you have to be checking your expiry date every 6 months. And then know that the moment you exceed 24 hours of first aid or taking first aid, then you are doing self-medication or drug abuse. So immediately you realize that you are not responding to the first aid within 24 hours, you need to seek a medical attention. Yes, and then be sure that every medication in your first aid boxes, especially the oral ones, whether they are after meals or before meals. And also make sure that you get a bowl or a bag with a cover or a bag with a zip that you can store in a cool, dry place. Thank you.
Thank you so much, Ms.
Thank
Bodu,
you, David,
for taking us through how to organize our first aid kits for our homes and all the places that are necessary. We have first aid kits. And so, viewers, we have come to the end of another beautiful episode, an educative one indeed. And I'm sure you've learned a lot. A very big thank you goes to Farm Stephen Odum of Sterida Pharmaceuticals Limited for giving us the Afrikiko branch to host this particular episode. And also a big thank you again goes to our resource person, Miss Bodu. Thank you so much. And to my wonderful media crew, Anchor Media. And our motivation for the week: if you are going through hell, keep going. Appreciate where you are in your journey, even if it's not where you want to be. Remember, every season serves a purpose. My name is Victoria Dede Mensah, and I have been your host. See you again another time. Bye. Bye.